Thank you very much. Thank you very much to Health Scotland for the invitation to come along this morning to address a large audience, and that's tremendous, about an issue which I think is hugely important, and hopefully from today we can continue to emphasise the importance of that. You will undoubtedly hear this several times today, but the challenge and the big picture is that it remains the case that life expectancy for those with severe mental health problems or mental illness is substantially reduced when compared to the average in the rest of the society, and that people with severe mental illness are more likely to have physical illnesses and are less likely to receive appropriate and timely interventions for those. Why is it that people die earlier? And we will hear undoubtedly from some of the other speakers some of the evidence around this. But we know the reasons why this is. Smoking is more common. The links between mental health problems and obesity are clear, both from treatment effects and from the impact that obesity has on mental health. I've heard from Graham, alcohol use is a major factor in the early mortality. In some of our local data in Lanarkshire, alcohol came out as the biggest cause of the early death in a group of inpatients where we found the gap actually to be 30 years as opposed to 15 or 20 years. We know that we have a focus on suicide, but we also have an understanding that deprivation is a major factor in premature mortality, less physical activity, and there is this concept which is often talked about of diagnostic overshadowing. So that sense that somebody who is known to have a mental health problem presenting to, whether it be primary care or whether it be through accident emergency or other services, are less likely to have their physical problems picked up and the appropriate interventions offered because it's seen as part of the mental health problem. So why is it important that we begin to address this now? There does seem to be a sense that there's a momentum gathering around this agenda. The college had its winter meeting in Glasgow just 4 or 5 weeks ago and had this as our focus within that discussion. We are moving into a new organisational structure in which health organisations and social care organisations are about to come together. So there's an opportunity within that to look at what our priorities are going to be as we move forward in thinking about how we plan services within local authorities and within health boards to better meet individuals' needs. And we're also coming towards the end of the Mental Health Strategy 12-15, and there will be a new strategy that follows on from that. So there's an opportunity there to say, actually, what do we want within that strategy that might begin to address this gap? I don't think there's anybody in this room would say that that is a tolerable or an acceptable gap to have in terms of that difference. So what are the things that we could do about it that could help us to shape that next mental health strategy? We don't know when the next mental health strategy will be written. Our suspicion from the college perspective is that there may be some mileage in trying to push that we hold off the next strategy being written until after the May 16 elections, and that what we try to do, and this is, I suppose, the challenge for this group as a collective, how do we try to influence our politicians as they head into that election, that one of their priorities in 16 would be, when coming to office, that they're going to address this gap as part of that strategy. I just wanted to highlight a couple of lines from the 2020 vision. If we talk about policy, what is the policy of the NHS in Scotland? It is the 2020 vision. But I suppose that the word I would pick out from this is that by 2020, everyone is able to live longer, healthier lives. That is the key to this. The issue of early mortality for those with severe mental health problems is one of the major contributions to health inequality within our society. So if we can find ways to begin to address that, we can begin to improve the idea that everybody is able to live those longer, healthier lives. The rest of it, I think is chimes very well with those of us that work within mental health services in terms of a move away from institutional and hospital care and towards more focus on community and on developing community assets so that we can ensure that people live those longer, healthier lives at home as much as possible. If we look at the current mental health strategy, this isn't the idea that improving physical health isn't new. It's been around in all the strategies over the last few years, but the commitment within the current strategy is about continuing to work with boards to support a range of health improvement approaches. Great, and part of what we'll hear today is around tests of change and around some of the work that has been going on around that. The second half of that, in terms of developing a national standard, is something that's been done. And again, all these things contribute. So what we're not doing today is saying this is something that nobody's doing anything about and we need to start afresh. There is work ongoing, but I think one of the pushes today has to be, so how do we encourage more momentum around that, and how do we bring that together as a greater priority at both policy and political level? The health and social care partnerships will be driven by the health and wellbeing outcomes. I've just underlined a couple of those that I think are hugely relevant to the work that we're discussing today. So again, it's about everybody living in good health for longer. That's what we're looking to push here. And that health and social care partnerships, as they're largely going to be, should be looking to how they contribute to reducing health inequalities. So within those, there are some hooks that we can use in terms of driving forward this agenda as a priority for health and social care organisations. So the challenge for today. What is our goal? Do we have one? Do we understand? Do we just want to see if we can make things a bit better? Or should we be more ambitious than that? Should we be, as a society, and people here as potential influencers in that society, be saying, actually, it's unacceptable to have a group within our society, those who have mental health problems and severe mental illness, who die 15 to 20 years earlier than everybody else. So surely our goal should be to change that. So what would we do if we set out that as a goal? What are the sorts of things that we would need to do to change that? We're going to hear some examples today, but I'll give you some thoughts in a minute or two. And how do we then ensure that our policymakers are signed up to that goal and that it becomes a priority that it deserves? So how might we reduce the gap? And these are some thoughts. Some others will give you some of the evidence further on of what works or what might work. I found Graham's talk very powerful. Actually, at the beginning of this, there is something about if we want to help people improve their physical health and their physical activity, they need to want to. And that's about self-esteem. It's about reducing stigma. It's about promoting a recovery and encouraging and enabling people to self-manage. So all these concepts, which are part of the work that sits within our health improvement strategies already and sits with CME and sits with many of the other things, these all feed in to that as an objective, to the objective of reducing mortality. But hugely important that we start at that basis. The next thing is, why is it, I'm going to use Graham again, but why is it that Graham is now reaching the point where he is realising the importance of this? When someone is first diagnosed and first enters the system, that's the point where we need to be really emphasising the importance of their physical health as well as their mental ill health, and really trying to encourage those positive health behaviours right at the very beginning of that journey, as well as continuing to do that all the way through the rest of the journey. There's a bit of me that wonders whether we get this wrong sometimes, because a lot of the time we say to people, you need to stop smoking because it's bad for you. You need to lose weight because it'll cause you lots of other physical health problems. You're going to get diabetes, you're going to get all these things. We get lots of negative messages about all the bad things that are going to happen to you if you continue with these risky health behaviours. What about emphasising some of the benefits that people will get from from increasing their physical activity, from improving their diet, from reducing their alcohol, from doing all the things that we know work, in terms of their mental health as well as the physical health that they will get. And we know that there are good links between those things. So something there about really positive messages. But those positive messages also need to come from staff, or to staff, as well as service users. So how much do we encourage and focus on the physical activity and health and positive health of those working in the service, who are then, in turn, working with those who use the service? We clearly need to improve access to physical health support and interventions. And there's something there about stigma within health services. So how do we work with the Accident Emergency Department to ensure that when someone comes in where they've got a mental health label, that's not immediately overshadowing the problem that they're presenting with? We can undoubtedly do better in terms of things like targeting smoking cessation support. One size doesn't fit all. We may need to do more to support those with serious mental health problems. We need to get right the issues around alcohol and or drug use. And we'll hear more, I'm sure, as the day goes on, about interventions to promote diet, exercise changing, and about how health and social care partnerships might be a vehicle for building the assets within local communities that mean it's easier for people to get access and to get into these services. So these are all things that we might do to reduce that gap. I don't think any of these things are, none of them are particularly difficult as concepts. Some of them are very difficult in terms of how you would set things up and resource them. But what we've tended to do, I think, over the last 10, 15 years is to say, yes, there are some issues here. Let's try a little project here, a little project there. And we haven't had a sort of single big priority around joining this together as a policy drive. So, for today, I suppose what we're going to hear is some of the good work that's going on. Hopefully we're going to hear about some of the things that work. I suspect we're going to hear a little bit about how big the problem is and how difficult the problem is, but also some of the things that work and how we might expand and build on those. The college are, at the moment, having a think about what would be the sorts of areas which we would want to push in terms of our politicians and our policymakers in Scottish Government to set as we move into thinking about next election and the 16 strategy. Just a question for today, but hopefully one that's a slightly rhetorical question, but is it time for our government to set as a target or an objective, standard, whatever they choose to do, that what boards and health and social care partnerships should set out to do is to reduce that gap? So, one, they would have to measure it. Two, we would have to look at the range of interventions, some of which I've mentioned earlier in the talk, which would be put in place in order to deliver that. And it would ensure that health and social care partnerships and boards made this a high priority. And in terms of managing resources and managing, we need to be a high priority if we're going to make good progress in the new environment. So I'm going to stop there for now. It would be interesting to hear people's views on whether we should set that as an objective or a target over the course of the day. But I will move on and allow the next speaker to give you some of the evidence, hopefully. Thank you.